Every year on Women's Day, we hear people talking so much about women's health, but mostly it's about gynecological health and mental health issues. But you know what? There's so much more to health when it comes to women. Inclusive health is really what is required. So today, let's talk to some of our experts and understand from them how we as women can take better care of ourselves.
There's a popular misconception that liver failure affects only the male gender and only alcohol is the cause of the liver failure. Nothing can be far from the truth than this. Progressively, we see more and more females presenting with the liver failure. And a lot of this problem is because of NFLD or non-alcoholic fatty liver disease. Just because of the body habitus, hormones of the females and the lifestyle, more and more females are presenting with NFLD. Hence, it is very imperative for all the women out there to get their yearly health checkup, get their liver ultrasound so that we can pick the liver failure at the early stage and we can treat them.
I would like to talk about the importance of eye health in women. It is surprising to know that women suffer from eye diseases more commonly than men. They suffer from eye diseases like cataract, diabetic retinopathy, glaucoma, and age-related macular degenerative changes much more often than men. All these conditions have to be kept in mind, and women have to think of these things and make time for themselves to change their lifestyle and to get themselves examined.
As a female neurologist, I always felt that I should sensitize all my women friends that at different stages of life, there are multiple neurological diseases which are seen in women. I feel it's my duty to sensitize everybody about it. In the younger age, maybe migraine, epilepsy, very young women, multiple sclerosis. I always feel that, never neglect your symptoms. When the symptoms come, go to the neurologist and get yourself examined well.
Managing diabetes in women has got its own challenges, and these challenges may be dynamic across the lifespan of a woman. Like adolescents who have type 2 diabetes, they often have coexisting PCOS. Women in the reproductive lifespan may experience a variety of problems related to hormonal changes, problems where the diabetes may aggravate during pregnancy. We all need to be more inclusive, more supportive of women's health so that they can manage their diabetes well and have good outcomes.
Working women or working moms, we often speak about achieving the perfect work-life balance. But many a times, it is not as perfect as we think it is. So, the first lesson is learn to say no. The second lesson is reach out whenever you feel you're overwhelmed. And lastly, reach out to women health groups.
8 March is celebrated worldwide as Women's Day. As women, we always tend to put family first before our own health. On the occasion of Women's Day, I request all the women to please put their health in the forefront. It is important that you remain yourself very healthy so that you can take care of your family. So I know there is awareness, women are more aware now about their own health, but do act on that and get yourself checked.
This Women's Day, it's important for us to understand that women in all age groups, right from the time that they are born till the time that we are elderly, require prevention from various infections. Now, this is something that can be easily achieved by taking vaccination. Similarly, there are multiple vaccines which are available which need to be again redone as an adult if your immune system has gone down, like your MMR vaccine, your tetanus vaccine, your diphtheria vaccine, your HPV vaccine, your flu vaccine. Some of these are important when we grow older so that we can prevent infections in us and can give women a better quality of life, which is what they truly deserve.
Hypertension in girls, is that a thing? Yes, we are seeing more and more children with high blood pressure. As a population, we are becoming more obese, our dietary habits are changing, we are eating more and more salt. That's why we are seeing more and more girls with hypertension. It's very easy to check blood pressure, so that's why everyone should check blood pressure. And that's how we can screen everyone to identify hypertension, prevent it, treat it early so that there are no untoward consequences.
Ladies go through 2 stages which men don't go through. Ladies को 2 ऐसी stages life में आती है एक है इसमें प्रेगनेंसी, दूसरा है मेनोपॉज। प्रेगनेंसी में लेडी को एक जगह पे 2 लोगों को फीड करना पड़ता है, इसलिए कैल्शियम डेफिशिएंसी हो सकता है। इन एडिशन टू कैल्शियम, विटामिन डी एंड वेट बेरिंग एक्सरसाइज, what is required कि a balanced diet with a good balance of protein is required.
We are warriors on multiple fronts. Whether this is a belief imposed by society or something that comes from within, we need to put our best foot forward. And here I suggest 4 M's for you. The first M for meals. Make sure it's a heart-healthy meal. And the next M is for moderate exercise. 30 minutes daily, 5 times a week of vigorous walking should do that for you. Don't forget the third M, which is muscle strengthening. 2 sessions of weightlifting, 2 sessions a week. And fourth is a mindset which should be positive.
In this occasion of Women's Day, I would like to tell you and would like to bring your attention to very, very important women health issues, particularly at the later age of their life, and that is the back pain, the spine related issues. So I would like to advise you should maintain your healthy activity, more focus on yoga. Swimming should be continued. In yoga, particularly the Bhujangasana and Surya Namaskar, at least 5 times a day in the morning will make a healthy spine for all of your life. You have a more healthy fibrous diet, more calcium rich diet, and best wishes for your healthy woman's spine in this Women's Day.
जब हम एरोप्लेन में जाते हैं तो वहाँ कहा जाता है अपना मास्क पहले लगाएं फिर दूसरों की हेल्प करें. On this Women's Day, I want to tell all the beautiful women who are the most selfless, generous and loving creatures on earth that the most selfless act that we can do to help others is to take care of ourselves. जब हम strong होंगे, हम happy होंगे, हम healthy होंगे, तो हम happiness, health और strength ही बांटेंगे.
This day, 8th of March, I wish to talk to you about equality versus equity, especially in healthcare. Equality assumes that the same set of interventions would work for everybody for a given outcome. As against that, equity is about understanding and acknowledging that different people need diverse, different attentions and different interventions for the same outcome.
This Women's Day,
This Women's Day,
This Women's Day,
This Women's Day.
This Women's Day.
So this Women's Day,
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 This Women's Day.
This Women's Day,
This Women's Day, let's inspire inclusion by prioritizing women's health.